Good afternoon, and thank you for joining us on Facebook Live. I am Mayor David Alvey, and with me today is Dr. Alan Greiner and Terry Garrison, and I'll be introducing them in a moment. But as Mayor, I want to let you know that in our response to the coronavirus, we have been in constant contact with our state and regional health department officials, the Kansas Department of Health and Welfare, environment, and we are taking all measures necessary to try and slow the spread of the coronavirus, but also to provide measures that will help protect our citizens from contacting the virus. We have instituted several key measures that will assist in mitigating and reducing the risk of the spread of COVID-19, and I'm confident that our residents will take the appropriate steps to ensure their own health and the health of their families. And to be sure, to date, Wyandotte County does not have a confirmed positive test for COVID-19. Again, as of this moment, we do not have a confirmed case of COVID-19 in Wyandotte County. However, we expect that there will be a positive test eventually. We do not know when, but at this point, we do not have a positive test. As part of our policies, we are strongly recommending, as a unified government, to our citizens and to our agencies across the city and community organizations that large gatherings be postponed or canceled for the time being to help reduce the risk of spread of the contagion. And out of caution for our citizens and for our employees, the special session scheduled for tonight at 5 regarding the Safe and Welcoming Ordinance has been postponed to a later date. Also, the vote tonight during the regular session at 7 o'clock on the stormwater fee adjustment has also been postponed to a later date. We anticipated that we were going to have large crowds of people attending for those sessions, and in order to help protect against the spread of the contagion, we have postponed those to a later date. I also want to let you know that Kansas City, Kansas is not declaring a state of emergency at this time. However, it is important that our citizens understand that this is an important matter. We take it very seriously. And of course, as we move forward, we will take any appropriate measure necessary to protect our citizens and to halt the spread of the contagion. The option remains open, therefore, for us to consider declaring a state of emergency, but we believe the measures we have in place are going to accomplish what we need to do. We think we're taking the appropriate measures and are not yet going to a state of emergency. Having said that, Unified Government Administrator Doug Bach and his staff are exploring all ways to continue to provide public services while minimizing the spread of the contagion across all operations. And with me today, again, are Dr. Alan Greiner, the Chief Medical Officer for the Unified Government, and Ms. Terry Garrison, the Interim Medical Director for the Health Department serving Wyandotte County. These professionals lead our preparation and response efforts in Wyandotte County. And for more details on the actions we're asking our residents to take, I'm going to turn it over to Dr. Greiner and Ms. Garrison. Dr. Greiner.
Thank you, Mayor Alvey. Ladies and gentlemen, thank you for being here with us today. Let me reiterate that we have put together a list of actions that our residents can take now as a community and come together to face COVID-19. We feel our current measured and but yet proactive approach will be the most effective way to protect the health of our residents. We are also confident that we can all work together to prevent disease spread and reduce the impact of COVID-19. We are asking our residents to do several things. We also are asking businesses and local organizations to follow these steps as well. Please avoid large gatherings. Practice social distancing. If you're sick and have symptoms such as fever or cough, please stay home. If you develop symptoms such as fever or cough, call your healthcare provider and stay home until you receive additional instructions from his or her office. And practice good hygiene, such as frequent hand washing, coughing into your elbow, as well as keeping surfaces clean throughout your home and in public. It's also important to realize that certain members of our community are at greater risk from contracting COVID-19. These groups include our senior citizens, anyone who might be immunocompromised, including smokers, anyone with previously diagnosed respiratory issues, as well as others that we will update as needed. In addition, we're providing the public with a wealth of information on how to best protect themselves from COVID-19. For more details on this, I'm going to turn it over to Ms. Terry Garrison. Terry?
Thank you, Dr. Greiner. As Dr. Greiner has pointed out, we have several resources available to the public to use to get more information regarding COVID-19 and how to minimize your risk of exposure to the virus. We fully anticipate that eventually there will be a confirmed positive COVID-19 case within Wyandotte County. However, that is not the case at this time. Our objective in putting the following measures in place is to contain the virus and give our residents the information they need to minimize exposure to the virus. First and foremost, Wyandotte County provides a website with the latest information regarding COVID-19. That website is wykck.org/coronavirus. I would encourage anyone with questions regarding the COVID-19 to visit this website and to check the latest information from the Centers of Disease Control and Prevention, as well as the Kansas Department of Health and Environment websites for the latest information. Some of the most important tips, as Dr. Greiner indicated, is what we'd like to share with our residents on how to protect themselves and their families. Everyone should continue with the basic hygiene precautions to prevent the spread of the virus, including frequent hand washing, covering your cough with a tissue or sleeve, avoid touching your nose, eyes, or mouth with uncleaned hands, staying home if you are sick. Current evidence suggests that people with COVID-19 are most at risk for spreading the virus when they have the symptoms, such as the fever and coughing. So please stay home and if you begin to experience any of these symptoms. Most people who get COVID-19 experience mild symptoms. However, some people, including older adults and people with chronic health conditions, are at a much higher risk for severe illness from the COVID-19 virus. If you or a loved one are at higher risk for severe illness, follow the latest CDC guidelines for people at higher risk. They include having adequate medication and food and household supplies on hand for if you need to remain isolated in your home. Avoid crowds. Plan for what to do if your usual caregiver becomes sick and unable to care for you. Wear a mask in public is not necessarily recommended for those who are trying to avoid the infection. Masks are for those who actually have symptoms. You can learn more about this at the cdc.gov/COVID-19. KDHE encourages Kansans to work with your families to create a family action plan, including planning for medical and dietary needs and identifying a room within your home to separate those who are sick from the rest of the household. Again, you can learn more of these tips from KDHE website, kdheks.gov/coronavirus. In addition to the websites, Wyandotte County residents can also call the Wyandotte County Helpline at 311 with questions regarding COVID-19. Also, the Kansas Department of Health and Environment has a hotline number for people with just general questions regarding COVID-19. That number is 1-866-534-3463. For people who have developed symptoms of COVID-19, which include fever, cough, or shortness of breath, please call your regular healthcare provider regarding your symptoms and any recent travel history. Testing is done based on symptoms and other variables such as travel and contact with known positive patients. My department has been educating healthcare providers on appropriate care and precautions and will continue to do so throughout the community. With that, I am going to turn the microphone back over to Mayor Alvey for closing remarks. Mayor Alvey?
Thank you, Terry. So again, we are in daily communication with government agencies and healthcare experts at the local, regional, state, and federal level to, first of all, monitor for outbreaks of the virus, to get the latest information about how this is progressing. We're also educating our public on ways to protect themselves from exposure to the virus. The information was provided during this broadcast is, I think, very helpful. Please go to the websites to get the most updated information. You know, the Kansas City Metro has been faced with public health challenges before. We've persevered then, just as we will now. We're going to take any step necessary to slow the progress and to treat those who are affected. So please be confident in that. And we are, again, strongly recommending that if you are part of a large gathering, that you not attend that if at all possible. If any gathering that's going to bring you in close proximity to large numbers of people, you might want to, take a look at that and ask if that's really necessary. The more we concentrate people together, the more risk of contagion. And again, pursuant to that recommendation from the unified government, we are following that recommendation ourselves. And therefore, the special session scheduled for 5 o'clock this evening on the Safe and Welcoming Ordinance, again, has been postponed to a later date. Also, I know a lot of people might want to come out tonight to the regular session for the stormwater fee adjustment. We're going to postpone that vote to a later date as well. Again, this is all an attempt to protect our citizens and to slow the spread of this virus. If that's all we need to say. If you have any questions, please, you can access us through Facebook Live.
Yes, and I believe we're going to move on to the Q&A portion today. My name is Janelle Friesen. I'm the Public Information Officer for the Unified Government Public Health Department, and I'm going to be going through some of the questions that our Facebook audience have been posting for us. So our first question is, what is the exact protocol for testing? So I believe Terry or Dr. Greiner would be able to respond to this.
So again, we urge individuals that develop symptoms to call their healthcare providers before presenting at a healthcare facility. Of course, if an individual has some kind of healthcare emergency, all of our public services are still in place. So of course, dial 911 if you feel like you have an emergency. But if you just have symptoms of an illness, we want you to call your healthcare provider. If your healthcare provider gives you instructions to come to see them, we've been educating healthcare providers across the community how to conduct testing safely in their offices. They may do things such as have you put on a mask when you arrive at the facility, or they may do things like have you not wait in a waiting room, but then they have protocols both from us, the Kansas Department of Health and Environment, as well as the CDC on exactly how to do the swabs that are necessary, how to store and then transport those swabs. And currently, we now have multiple ways to get that testing done. We don't feel like there's going to be any shortage of testing availability. So again, work through your healthcare providers for that.
All right, our next question is, what's the difference between the flu and COVID-19? Dr. Greiner, do you want to take that one as well?
Sure, that's a great question. There are thousands of viruses, right? Viruses are small organisms that contain genetic material, DNA or RNA, and they replicate inside their host, which can be animals or humans. You may have heard some about the spread of these viruses from animals to humans. Influenza is an endemic virus. We have it every year across the world, across the globe, and in some ways that allows us to protect ourselves a little bit better and prepare a little bit better with influenza. The genetic code of that virus is different than the genetic code for coronavirus, and of course COVID-19 is a special coronavirus with a mutation in what we've seen with other coronaviruses that's brand new in humans. And the reason we think it's causing such a severe problem is people don't have immunity to a virus that has that new genetic code and produces the kind of proteins it produces. So that's the difference.
All right, in the event that public schools are closed, what steps will be taken to address the needs of children relying on schools for meals?
That's an excellent question. I think that's actually best answered by the school districts who administer those programs.
And I believe that we'll be in communication with the school districts as well.
Absolutely.
All right, since BPU is part of the unified government, what is the shut-off policy during a local, state, or national emergency? Will families have to worry about losing electricity, water, trash during a pandemic?
So to be clear, the BPU is not part of the unified government. It is a separate agency. It is an agency of the unified government, but it has its own charter and its own administration. So I'm certain, I was in conversation with Bill Johnson, the general manager, just about an hour ago, and they will be issuing their own kind of guidelines and recommendations about how they're going to conduct operations during this time.
All right, there's another question saying, will we shut down the UG?
Well, it's very difficult to shut down the unified government. Obviously, emergency services have to continue on. We're going to continue to try and provide the services that our citizens need so we can conduct business. But at the same time, we're looking for ways that we can minimize exposure of our employees to the virus and also to continue to provide the service to those who need it. So we're looking at, in all operations, what are those things we can do? We intend to probably do a lot more conference calls. There'll be a lot more phone conversations with people, but we're going to find ways to do this. But to shut down the unified government is simply not an option.
All right, our next question is for Terry or Dr. Greiner. How is it spread, in the air or by touch?
Well, the COVID-19 virus is spread as all other viruses are, and that is why we recommend you cover your cough. It is generally spread through the respiratory droplets that we tend to spew, whether we mean to or not, as we speak or as we cough or we sneeze. And so that's the importance of the respiratory hygiene things that we need to do, like cover your cough, use Kleenexes and throw them away appropriately because it is in the droplets.
And I'll add to that, we do have some evidence from China and other countries that we don't believe that this virus, COVID-19, actually floats through the air and can go long distances and infect people that way. There are diseases that can do that. Diseases like measles and chickenpox are actually much more contagious to close contacts than COVID-19 is. But droplet spread, which again can come from sneezing, coughing, bodily fluids, if individuals do produce those droplets, others touch those droplets, and then especially if they touch their face, mouth, nose, eyes, we think that that's the way this virus is really spreading. So that's why we really emphasize, as Terry said, covering your cough, being careful to wash your hands frequently, and being careful with surfaces that you're exposed to and how often you touch your face.
All right. We did have a question about visitation at the jails, and I got a notification here confirming, so I'll take the answer to that the sheriff suspended visitation at the jail. If you have any further comments on that, we can go from there as well. I think we can follow up with if the sheriff has more information. Okay, we have someone saying, I worry about the economy. The stock market is rough right now. What measures are being taken to stabilize the economy? What is the pandemic expected to do to families financially?
Well, I mean, clearly it's going to be a burden. You know, when you look at those, especially in the hospitality industry, they're going to take a hit. Just the folks who would have been involved in the Big 12 tournament this past week, you know, those people are, you know, make an hourly wage. That's a really hit for them. People will start, their decisions will start, you know, making different kinds of decisions based upon their income, and that could be dependent upon how this COVID virus proceeds. But the economy is made up of, you know, 5 billion decisions a day by individuals all across the country. So that's something larger than any of us, I think, could answer.
All right. What about child care centers? Is there a certain protocol to follow? Terry, would you like to speak to that?
Yes, Kansas Department of Health and Environment has created guidances for child care facilities, and we, in the health department, we do have our child care licensing division, and they have shared that information out to all of our child care facilities within our county, and are working very closely with them on doing appropriate measures within their facilities.
All right, another question you may want to talk about is, do we have any information to give to the Latino community in Spanish?
Yes, all of our flyers, actually Janelle is our communications PIO, and she has created several different flyers regarding COVID-19 and the importance of it, and they are also translated into the Spanish language as well, and they are readily available on our website, as well as information is available on the other websites as well in Spanish.
Is this strain transferable through animals? Dr. Greiner, would you be able to speak to that?
Sure. Again, we don't know all of the science about this virus at this point, but we do think that it's likely that it had an original animal source. We don't know if animals have been transferring it back and forth, or if sometimes we see viruses that transfer from one animal to another species of animal and then to humans. So we don't have all the science, but we think it's likely that it originated that way.
All right, we have another question. It's related to testing, but what is the protocol specifically with positive testing? What is done if someone tests positive? Could you clarify that a little bit further?
If we are notified at the health department, when we are notified that an individual has been tested positive, we do what's called a contact investigation regarding that person. So we basically do tracing backwards from the time they had symptoms to the time we got the positive test, and find out the places that they attended, the individuals that they came in contact with, and we start monitoring those individuals for any signs and symptoms or possible testing based on KDHE's recommendations.
All right, we have time for one more question, and this is a bit of a broader question for you all, and that is, should we be concerned?
Well, absolutely. This is, there have been I understand there have been 126,000 confirmed cases worldwide, and I think 4,600 deaths. So this is something that really needs to be taken seriously, just as the flu needs to be taken seriously. So obviously, I think so.
All right, thank you very much. We will, of course, have follow-up information on our social media and on our website, and you can always find out the latest guidance on the websites of the CDC and KDHE. Thank you.